Great. Hi, everyone. Great to see you. Welcome, welcome. My name is Rachel. I'm the Director of School Services here at KLRN. I see a lot of familiar friends joining us this evening. And friends, we're so excited to have a new friend, our special guest, Dr. Jason Rosenfeld of Health Confianza. Welcome, Dr. Rosenfeld.
Hey, thanks for having me.
Of course. Thank you for being here. So this evening, we are going to be talking about how to spring into healthy habits. So thinking about what healthy habits are, that includes things good nutrition, staying physically active, also remembering to wash our hands and how to properly do that. So there's lots of good advice that Dr. Rosenfeld is going to be sharing with us this evening. And we also have some of our healthy kids resources, lots of good stuff to share. This evening's session is supported by the San Antonio Medical Foundation and First Mark Credit Union and Health Confianza. And Dr. Rosenfeld, we're so glad you're here. My teacher friends who are joining us this evening, so glad you're here. I think we're all very familiar with Zoom. Unfortunately, the last time we got together via Zoom, it was keeping me on my toes. And even in my last meeting with Dr. Rosenfeld, Zoom was keeping me on my toes. So sometimes it logs us out. Sometimes it wants to do an update without any warning. If that happens, please just take a breath, email me, let me know if you can't get back in, and I will try my very best to get you back in as timely of a fashion as possible, because I know that is sometimes frustrating. Thanks for joining us. Okay. So as always in today's session, we're going to explore the Healthy Kids Project. As a reminder, these are TEKS aligned teaching resources that are designed with teachers in mind, but also something that anybody can use. So if you are someone who doesn't consider yourself an educator, please know that you are an educator, and we encourage you to use these resources and that they are aligned to the TEKS. So you can use them in your classroom and you don't have to reinvent the wheel by finding the TEKS. We're thrilled to have our special guest, Dr. Jason Rosenfeld of Health Confianza, joining us today. We get some great advice and information, and he's also going to share his slides with you as well. So you'll have that as a resource as well. A certificate with 2 hours of continuing education credit will be awarded on completion of today's session and the accompanying post survey. So as you know, that's something that you can either scan with your phone, scan the QR code with your phone, or you can click on the link in the chat. If you're joining us by phone today and you're not able to do either one, if you could just go ahead and send me a message that you're not able to click on the link or scan the QR code, and especially if you're joining us from the car, please just unmute if you can at some point and let me know that you are having trouble accessing the survey, and I can send that your way. Okay, friends. So thank you for the amazing work that you do. And I'd like to share with you a little bit about Health Confianza and Wellness Cultura. But first things first, let's welcome Dr. Jason Rosenfeld. We're delighted to have you joining us today. You've had various roles with both students and residents at Long School of Medicine. And I will pass the microphone to you, my friend, because you can explain this much better than I can. Thank you for joining us.
Yeah, sure. Thanks for having me again. It's good to be with you all this evening. Got that young picture of me. God, that was many years ago to send you an updated version of it, but always good to reflect on where we used to be. So, yeah, no, by way of background and introduction, I've been at UT Health San Antonio Long School of Medicine and the Cheever Center for Medical Humanities and Ethics now for almost 13 years. And so I've been fortunate to serve as the director of global health education for our center, which serves the entire institution, helping to provide both training for our medical students and other health professionals in global health practice and public health programming, but then also creating opportunities for our students to travel across international borders to engage in cross-cultural learning and public health practice, helping to address community prioritize needs while also learning how to provide empathetic care. And so the other kind of part of my role is to provide public health guidance and training to healthcare professionals that don't always have opportunities to get that formal training. So I'm a public health professional by training. got my master's in public health from Emory University up in Atlanta, Georgia, and then got my doctorate in public health leadership from the University of North Carolina. And so I'm happy to be with you all today to share some of my work and experiences engaging in community-based health education around hand washing and kind of basic preventive health practices that I think you will hopefully find interesting and stimulating. Yeah, so Rachel, I'm not sure if you want me to jump into it or if you've got other things that you'd like to share with the group.
You're more than welcome to jump in, and I realized I hadn't stopped sharing, and so I needed to give you the opportunity to do that. So please feel free to go ahead.
Yeah, you're good. Well, good. It's good to be with you all again. Um, for me, what I'm just gonna kind of start off with.
Sorry, Dr. Rosenfeld, I think your screen froze.
Okay, it looks like I'm back. So let's try this again. Can you guys hear me okay?
We sure can.
Right. Trying to find where. I don't understand where you all went. Give me 1 second. I'm sorry. As you said, sometimes Zoom does crazy things.
No worries. We're here. I think we can all see your screen. You're doing great. Sometimes the participants list or the video footage will just go to the nether, and then it'll come
Okay.
back. Got it. Great.
All right.
Thanks.
Well, I can't see you all, but I know that you're there. So feel free if you would like to turn on your cameras to create a communal environment here. If you're not in a space where that's possible, also fine. This is laid back. This is relaxed. So if you've got questions you'd like to kind of dwell on a point or a concept that we're jumping into, please feel free to let me know in the chat or unmute. Again, I can't see people for some reason. I can't get the video up right now, but just let me know where you'd like to start. So I've kind of already done my little bit of introduction. Part of what I also like to know is like who is in the room. And so I know we've got some educators and other folks, but if folks are willing to kind of tell a little bit who they are in the chat, who they're representing, if they're coming from a school, which school are they coming from, and maybe what grades they teach. It's always nice just to kind of know who's here with me today. And so we can kind of run through that as I'm going through this introduction to Health Confianza, because one of the parts that I didn't get to in my own introduction to myself is that I've been fortunate over the last 2.5 years to lead an amazing team that is implementing this Health Confianza program, which is a South Texas health literacy initiative. And so what Health Confianza is it is a program designed to improve the availability of access to and utilization of vital health information and services across San Antonio and the South Texas area. And our hypothesis, our why, is really that we believe that together, by creating relationships with schools, with nonprofit organizations, with churches, with community centers, with the healthcare system, that we can create a more informed, confident, and healthier community. And so when we designed our program and our name, we intentionally came up with the name Confianza because we wanted to have the dual meaning and dual purpose of both building trust and confidence, which is what confianza means in Spanish. And so we are working to rebuild and build trust and restoring trust between our community and the healthcare system. But we also want to build people's confidence to access technically correct information and make good decisions with that information. Because at the end of the day, we don't want to be telling people what to do. We want to be able to give people the most scientifically accurate information that's available and then help people make the best decisions for themselves and for their families. And so the way that we do that is in a couple of strategies. We have some community-based strategies that provide training, like this one, although this isn't necessarily a training, but information sharing. And there's another model of community health clubs that I'm going to show you a video about a little bit later in our time together here. That's a way of sharing information amongst community that allows community and the members of that community to drive the conversation and to share their own knowledge about a certain topic before trying to work together to solve problems together. We also do a lot of health provider training around health literacy principles. How do you simplify language, use plain language when talking about healthcare issues? How do we make sure that the materials that we provide to our patients and to our community are in the language that they understand and simple to understand? But then also, like, how do we make sure that when we are providing information that we do what was called teach back, making sure that people understand and can interpret what we're sharing. So that's at that middle level, that kind of interpersonal communication. And then finally, at the organizational level, we also have some training for organizations to help them understand how can we develop policies and systems that are health literate, meaning do we have signage in our locations that are easy to understand and in the language that our community speaks? Do we hire employees and staff that look like the communities that we serve? Do we provide training for our staff so that they can provide health literate services to the communities that they serve? And so over the 2.5 years that we've been in operation, we've been fortunate to reach almost 13,000 people through a variety of different mechanisms. Again, through our community outreach events, mobile clinics, through health professional trainings, through our pledge program, which is that organizational program. And this is not to even mention the work that we do with our mass media and social media endeavors. And so Wellness Cultura is a new website that my colleague Sandra Zaragoza, who is our marketing communications specialist, has developed that provides easy to understand information about preventive health. What does it mean? What are the things that we can do to promote preventive health in our communities? But then also, what are some of the things that we should ask when we go see our healthcare provider? So visit Wellness Cultura. Hopefully you'll find some information that's useful for you or for the communities that you serve. But again, the goal is to provide that information, train community health workers, physicians, nurses, and others in health literate principles with that ultimate goal of helping people make informed, healthy decisions for themselves. So I'm going to now transition into the topic of the day. And so when Health Confianza began our partnership with KLRN, and we were offered the opportunity to spend some time with you in these evening sessions, I got to thinking about, well, what are some of the things that we think about in the spring? What are some things that we can do to promote health and well-being amongst our communities and amongst our children? And one of the topics that is very near and dear to my heart is that of hand washing. And the reason being, as kind of I mentioned before, I've been fortunate to have spent a number of years in sub-Saharan Africa and low and middle income countries around the world, working on health education programs that promote hand hygiene, safe water, and safe sanitation. Because one of the underlying causes of poor health around the world, as I'm going to show you in a moment, is diarrheal diseases and respiratory infections. And some of the best ways to promote that is through hand washing. And I want to start with just the history of where kind of the value of hand washing kind of began. And so some of you may recognize this person, many of you probably do not, but this individual is Dr. Ignaz Semmelweis. And this is an image from back in the late 1800s. And he is what we consider to be the father of hand washing. And so what happened was that he began to understand that when women were coming into the healthcare system to deliver their children, they were dying at rates that were 10 to 20 times greater than that of women who were delivering at home with midwives and otherwise. And what he quickly began to realize was that it was because the physicians and the healthcare providers that were helping with the deliveries were moving from rooms where they were conducting surgeries and other invasive procedures, and then moving directly into the maternity ward and helping to deliver babies, bringing the germs and potential infections on their hands with them. And so when he began to lecture and tell people about this, everyone thought he was crazy. There is no way that what you're talking about is on our hands. It is just bad air. It is just the poor luck of these women. And so he made this. He was constantly promoting the need for hand washing. And it wasn't until, hundreds of years later that finally germ theory had been established as understood science and recognized disease transmission pathways that finally people recognized that, yes, Dr. Semmelweis was correct. And that we needed to be washing our hands. And as soon as our physicians began to wash hands, the rates of infections and deaths in hospitals began to decline. And so I start there to say that, hand washing has always long been uh, maybe an unrecognized and underappreciated way of preventing or promoting health and well-being. And I want to start with a little bit of data because I am a public health professional and I think data speaks volumes. So I want to start with some data now that we've kind of understand where the history of hand washing came from to make the case for why hand washing still today is a very important practice that we should be engaging in, particularly for our children, our young children under the age of 5. So if we start with just the major causes of child death around the world, and the data shows you here is 2015 because of the COVID-19 pandemic and all other disruptive features in the global environment, we haven't been able to update our data on here. But basically, what we know is that about 45% of deaths happen in the neonatal phase, which is between the ages of 0 and 1. The major causes of neonatal death are pneumonia, preterm, and interpartum related events. If we then move to the child death, which is ages 1 to 5, which is about 55% of deaths, we know that the majority of death is caused by upper respiratory infections like pneumonia and diarrheal diseases, about 9%. So that together we're looking at almost 25% of the cause of death being respiratory infections or diarrheal illnesses. Now, this is important because hand washing comes into play for both of those causes of child death, but also many of these drivers of neonatal death, particularly in low and middle income countries. It's a less prevalent issue in the United States, the causes of neonatal death being around hand hygiene. The other piece that I want to just highlight is that about a third of all childhood deaths are linked to malnutrition. And there are direct links between our hand hygiene and high rates of malnutrition, particularly in low and middle income countries where the causes of diarrheal diseases are related to hand hygiene, which then causes a condition where it's difficult for children to absorb the micronutrients and the nutrients needed to have healthy nutritional status. So I wanted to look at just mortality first, and then I wanted to look a little bit at the data of morbidity, which is the causes of poor health in general. Now, I'm going to take a moment just to kind of unpack what's in this slide because it may feel a little bit overwhelming, but I'm hoping to be able to convince you that it is not that overwhelming. So what the size of the square shows you is the size of the contribution to what we call disability adjusted life years, which is just a fancy way of saying sickness, right? So the size of the box shows you the contributor to global childhood sickness under the age of 5. The color, the depth of the color shows you the change and how prevalent that cause has been over the period of 1990 to 2019. So again, you can see a deeper, darker color in neonatal causes of illness, malaria being a driver, iron deficiency being a driver. But what I want to draw your attention to is that neonatal causes, lower respiratory infections, upper respiratory infections, and diarrheal illnesses make up almost half of the causes of poor health around the world. So this is every country around the world. And so I make that case to show you that this is still an important issue that we can address with really low cost interventions around health education, around hand washing. So if we then move to just Texas, And because the data in Texas and the United States are very similar, I wanted to look here. You can see that neonatal causes are still very large, and you still have a big contributor to lower respiratory and upper respiratory infections. Diarrheal diseases are less prevalent. But then on the other side, you see that asthma now begins to become a big driver of poor health in Texas in particular. So about 39% of poor health is caused in the neonatal phase. Around 3% is lower respiratory and upper respiratory infections, 1% diarrheal disease, and 3.3% asthma. So I just wanted to set the stage to say that, the drivers of poor health globally are slightly different than those here in Texas, but that respiratory infections, asthma, and other kind of respiratory conditions are still big drivers of poor health in the United States. I'm not sure how many folks have ever heard of this concept of the fecal oral disease route of transmission. But I want to spend just a moment on this because it is really important in the global setting. And it's one that I don't think we spend enough time thinking about here in the United States anymore. But the major causes of diarrheal infections in particular, right? Because our kids get diarrhea, it still happens, is because unfortunately feces in some way, shape, or form is entering their mouth. Right. And so it'll come through our drinking water. It can come through the fields. We go out and we play, and then we touch our food or our mouth. Flies are a great contributor to getting fecal contamination on our foods and even on our children, and then also our fingers, the biggest driver. And so while I'm going to show you just some data on how we can block all of these routes, I want to show you the power of hand washing in relation to diarrheal disease prevention. So if we begin with just drinking water, we know that we can reduce diarrheal diseases by about 15% by blocking that route. So less of an issue here in the United States because the majority of our communities, and especially here in San Antonio, we have pretty safe water systems. When we can make sure that our feces are being contaminated or contained and not getting into our environment, we can reduce diarrheal diseases by about 35%. But look what happens when we engage in hand washing. Almost 50% of diarrheal conditions can be prevented by blocking the route from having our hands washed after toilets and making sure that anytime that we're going to our hand or our mouth with our hands, that our hands are clean. And so this is not insignificant. And while this is focused on diarrheal illnesses, I really want to come in and hone in on common respiratory conditions because, we still live in an age, especially nowadays, as we're moving into spring and summer, when we've got all sorts of contributors to respiratory infections in our children. Any of you that are teachers or have children under the age of 5, you know what I'm talking about. Our kids are constantly coming home with respiratory infections and they're getting spread around. And so I've got some images up here talking about very different respiratory infections that we still have to deal with today. If anybody would like to unmute or in the chat, tell me what do they see. I'm showing you the scientific microscopic versions of these, and I want to just kind of see, does anybody know what is represented on this slide? Feel free to unmute or throw it into the chat if you see an image of something that you recognize. Yeah, so we've got allergens, Ashley, thank you.
COVID-19.
Yeah, we got COVID. Hopefully everyone knows that. It's stained in our brains now.
Asthma.
Yep. So here we got the inhaler representing asthma.
Bronchitis?
Not bronchitis. I don't have that up here. What is it? What are some other drivers of respiratory conditions in our children that people are aware of?
RSV.
RSV. There we go. That's this black and white image here in the middle. The last two on here are the cold and influenza. So I want to just start by talking a little bit about the data associated it. So as of kind of summer of 2023, which is our most recent data that I was able to find for children, about 15.6 million children reported to have tested positive for COVID-19 since the beginning of the pandemic, which was March of 2020. And so what we also know is that infants under the age of 6 months of age, they have similar COVID-19 associated hospitalization rates to adults aged 65 to 74. Those are our two most vulnerable populations. When they get sick with COVID, they can have some significant outcomes that are more severe than that of children of an older age. When we look at influenza, we know that children under the ages of 5, and especially those that are younger than 6 months of age, are at a higher risk of developing serious flu-related complications. And that from 2010 to 2020, the CDC estimated that flu-related hospitalizations among children younger than the age of 5 range between 6,000 to 27,000 per year, right? And so many more go to the doctor or go to urgent care centers because of influenza. Now, we don't have good data on the common cold because it happens, right? We get it all the time. It's not something that we go to the doctor necessarily and get a diagnosis of, but we know that the common cold is affecting our children constantly, and they're getting sneezes and coughs and sore throats. RSV, which is the respiratory syncytial virus infection. Each year, about 58 to 80,000 children younger than the age of 5 are hospitalized due to RSV infection. And again, infants, those children 0 to 6 months of age, being at the greatest risk of poor health outcomes associated with that. And then allergens, again, it's a hit or miss depending upon who you are. I can tell you that I grew up in North Texas, never suffered from allergies until I moved away and came back to San Antonio. And the minute I landed in San Antonio, boom, allergies. My eyes burn, my nose itches, and I never had allergies before. So there's something special about the allergens here in San Antonio. And then finally, with asthma, I mentioned this one because there are some relationships. It is a common respiratory condition for our children. We estimate that about 7.7% of children in the US have asthma, around 6.5% are under the age of 18. And in 2021, when data was last kind of collected in this, we knew about 38.7% of children under the age of 18 had an attack in the prior year, but that goes up to 63.1% for kids under the age of 5. So these are the common respiratory conditions that we see. And I know for all of our teachers, you see these in and out every single year. They ebb and flow. They especially hit in the summertime, where we get your allergies, you get your asthma, you get your RSV, you get your COVID. And then it spikes again in the fall and the winter. But sometimes we don't necessarily know how to distinguish one from the other. And so members of my team over the year have pulled together content to kind of help us identify the difference between them. And I wanted to show you, oops, I shouldn't have Mia poster. That was a note to myself that never got edited, but this is real life. So my colleague Mia was the one that developed this. And so what we just developed, and we're happy to make these posters available to anybody that would like to have one. We can coordinate with KLRN on how to get these to you, because we have these as resources for teachers, for healthcare providers, for community health workers. But you can see that there's a lot of commonalities across these common causes of respiratory illnesses. Stuffy nose or runny nose is across all of them. Less common for COVID than RSV, sneezing, wheezing, itchy eyes, fever, right? So we know that allergies and fever do not go together, but they do go with flu and COVID. Aches and pains are a very big sign of flu, less so for RSV and for allergies. What's important to know is that when the symptoms start, they're very different, right? So for allergies, the symptoms will begin right after exposure to the allergen. A cold, it just kind of begins to get worse over several days. With the flu, it can be a sudden start, right? And then you're hit, you're down, and you're out for a couple of days, 10 to 14 days. Whereas with COVID, it varies, right? I know when I got COVID, it was about 2 or 3 days after we knew that we had an exposure that we got hit, and then we were out for about 7 days. But again, it can last much longer because we do have something called long COVID or long haulers, and the symptoms there can last a whole lot longer. whereas RSV, it gets worse like cold over several days, but then it can last for 2 to 3 weeks. So I wanted to just share that there are very similarities between all of these common respiratory illnesses. And again, if you would like to have this chart, please let us know, and I will work with KLRN to make sure that we get you copies of those in some way, shape, or form. Okay. Pause there just to see if anybody has any questions about these common respiratory illnesses before we kind of get into prevention and some activities. I'm hoping that you guys will engage with me today. I'm a teacher at the heart. I love participation, so I'm hoping you guys will engage. But questions, comments on any of this content before we move on? All right. Again, please feel free to jump in anytime that you do. So what do we know about prevention? So before I show you the next slide, again, engage with me if you can unmute, if you can throw it in the chat. What are some of the ways that we know how to prevent these common respiratory conditions?
Sir, I had a question.
Sure.
I wanted to know, a lot of times the allergies are very similar to COVID, but a lot of people don't get all the symptoms. Why is that?
Are you talking about the symptoms for COVID?
Yes, for COVID.
Yeah, COVID is a really tricky virus. Like, unfortunately, my answer is not going to be probably very satisfying because everybody is different and everybody's um, signs and symptoms for COVID are very different, right? So the common things that we know is that you're going to get a cough, you're going to have some sort of headache and aches or pains. Some people will end up with a shortness of breath. Some people will have a loss of taste or smell, which is a very common indicator for COVID as compared to other things. But many won't. Some people will just feel like they had a really bad cold. For myself, I had severe fatigue, whereas I had a colleague that they were sick for a day and they were back at it. Because I think what's interesting about COVID is that it is both a respiratory condition, but also a multi-system condition. Usually, when you begin to feel more than just that respiratory illness, that fatigue, that body ache, other issues, that's when you may begin to suspect that you've got COVID. And so you're right, it's really hard. I've had so many people tell me, it's not COVID, it's just allergies. And then they happen to go take a test and then it turns out that it's COVID, or they vice versa, right? And so I think the trick is to just kind of keep in mind that with allergies, you're not going to have fever, you're not going to have aches or pains, you're not going to have diarrhea or some of these more severe issues. So if you begin to see some of those more severe signs or symptoms, then it's probably worth going to a healthcare provider, especially if it's prolonged, to get a test and then just confirm whether or not it's COVID, flu, RSV, or something else.
Okay. All right. Thank you so much.
You're welcome. All right, so back to this idea of prevention. So Sandra, thank you so much for jumping in there. Yeah, the cat's out of the bag. I started with hand washing. Hand washing is amazing. And we'll talk about that in more detail because I want to talk to you about what are some of the activities that we can do with our young ones to kind of teach them about hand washing. Sandra also mentions maintaining appropriate space from people, right? So we learned about social distancing during COVID, covering our coughs, staying wet, staying home when you're sick. Man, those were some great tips. Anybody else have ideas on how we can prevent some of these common respiratory conditions? Yeah, thanks, Sonia. Hand washing, covering your face when you sneeze or cough. All right, you got 3, 2, 1. All right, I'm going to move on. I'm going to show you, right? So we talked about masking. Again, for many people, this has now become a long-term practice because they're worried about their health status, but also making sure that they're protecting others around them. Reducing environmental exposures, both indoor and outdoor air quality, are really essential for aggravating respiratory conditions, in particular asthma. We also know that with many of these respiratory conditions, COVID, influenza, RSV, there are effective vaccines to reduce your risk for getting them. And I always want to be clear with vaccines that they are not a force field. It is not going to protect you 100% from getting a viral infection, but it will reduce the likelihood of getting that infection. And what we also know with COVID, without going down this rabbit hole, is that will reduce the likelihood of having a severe infection and then even having long COVID into the future. So vaccines are great. We talked about covering our coughs. I want to add an addendum to that. It's not just covering our coughs, it's not doing it with our hands, right? Because our hands are the transmitter of germs and bugs and dirt. And so if we're going to do it, we make sure we cough and sneeze into our elbow, into a cloth or otherwise. And then finally, hand washing. And this is where we're going to spend the rest of our time together, is focusing on hand washing, because what we know from the data around the world is that we can reduce the risk of diarrheal diseases by about 40% by practicing regular hand washing. For respiratory infections, the data is a little bit inconsistent, but the range is from about 6 to 44% of respiratory infections can be prevented by washing our hands. That is impressive, right? We don't often think about the relationship between hand hygiene and our respiratory illnesses. But again, if you think about what our hands are doing every single day, they're touching doorknobs, we're on game controllers, we're touching our money. Our cell phones are the dirtiest things in our house, but we touch them all the time and we don't think about necessarily washing our hands afterwards. But our hands are the biggest transmitters of illness and germs on our bodies and in our communities. And we have to be thinking regularly about how are we going to protect ourselves. So this is where we get into some participatory activities and some activities that I think you can do with your kiddos, whether you're a teacher after school or even if you're a parent. And so, yes, thank you, Carolyn. Hand sanitizer is another way of keeping our hands clean. I think some people don't like it because it can oftentimes dry out your hands if you're constantly using them. And I just always want to kind of promote the hand hygiene piece. The other thing that I want to say is we oftentimes say that you need to use soap when you're washing your hands, and the answer is yes. But sometimes if you don't have soap, if you can get like some sand or even ash is something that we teach in our global health program, because there are some antibacterial elements in ash that when you wash it with water can actually get the germs off of your hands. So the first activity that I would like you to engage with me, and this again, these are things that you can do in your classrooms with your kiddos in your after school programs, is a game called Before or After. Okay, so I'm going to show you some images here, and then we are going to go through and do this together. And the idea is, what the image is showing is, are you supposed to wash your hands before this activity, after this activity, or both of these activities, or both, before and after? So let's take a look at the pictures. I'm going to let you look at these for a moment. Think about your answers, and then we're going to go one by one, and you guys are going to tell me before, after, or both. And just in case this isn't clear, this is a elevator button. So, all right, let's start. We have some kiddos preparing some food. Is this before or after? Yeah, both. Thank you. Right. So we want our kiddos, we want everyone washing their hands before they touch food, right? Because otherwise they're going to put the germs all over. And then as soon as they're done, especially if they've been touching meats and other things, we got to wash our hands again. Okay. Awesome. You guys are doing great so far. 1 for 1. All right. Got Happy Mr. Toilet. Before or after? Right. So again, after, and ideally, this is not just if we're going number twosies, but if we're even going number 1, we're touching the toilet. You know, the toilet is a relatively germy environment. What's interesting, again, having worked in this space for the longest time, hand washing is one of the hardest things to even get adults to do. The data that shows the number of adults that will not wash their hands in a public bathroom unless somebody else is in the room with them, it's quite shocking. And so there's the power of peer pressure that we can apply to this. But anyway, the correct answer here is after. All right, we've got an elevator button. before or after. Yeah. So again, this is a public thing. We can think about door handles. We can think about um, those buttons, right? We don't often think about how many fingers have been touching that door handle, that button. So we're going to be after on this one. All right, we got a couple sitting down to have a delicious sandwich. Yeah, so most people are saying both here. Yeah, I mean, I would say definitely before, right? We've been working, we've been doing something. Make sure we wash our hands before we eat. If you want to wash your hands after, I'm not going to say no to you. I think the risk there is a little bit lower because ideally you haven't been getting up in the meantime and going and doing things. But sure, I'll get behind both on that one. So, all right, we got this kid who just clearly had a sneeze bomb all over the place. Yeah, right. And so again, yeah, oh boy, exactly right. I've got I've got two boys, 7 and 10, and this is not the first time I've ever seen this happen. So yeah, so ideally this kid is gonna, is gonna sneeze or cough or whatever into his elbow rather than into his hand. But once he's finished cleaning, and once you as a caretaker have finished cleaning this child up, let's make sure that we wash our hands. All right, we got a mother that is breastfeeding. Yeah, this is one that a lot of people don't think about. So we got both, right? And so what happens is oftentimes we don't think about washing our hands before we go and breastfeed our child, right? But we may be touching our own breast, we may be touching our child's mouth or face as we're getting them situated, and that's a great way to transmit illness unintended, right? And so great, we want to do it before and after. So again, I put that one in there because we don't often talk about the role of breastfeeding and hand washing being together. Finally, we got a bunch of kids outside playing a bunch of games, playing in the dirt. So after. So this is an easy activity that you can run with your kiddos. You can run it with your parents. You can come up with some images. You can put them up. You can put them up on a screen. You can print them out onto cards, and you can get people engaged in the learning process. Because what I have found in my years of teaching, and particularly with adults, is that there's power in letting people give voice to something. They can see it, they can internalize it, and then that message sticks with them longer when they themselves have said, this is when this should happen. And then they now have an image in their mind. Oh, yeah, that's that time I'm supposed to wash my hands. That's activity number one. Activity number two, you can take these same exact images and you can create a story around them, right? And so again, the power of storytelling is powerful. Because again, it helps us to think about the context of our own lives within an image itself, and then how do we think about the practice that we want to engage in related to that. So I would love if somebody is willing to unmute or even to type into the chat. You can choose one of these pictures. You can choose more than one. I'd love to hear a story about hand washing related to the picture or pictures that you choose. Let me give you a minute to kind of look and think, but I'd love to hear at least one. All right, I'm going to give you guys a quick example. So my son John went out to go play with his friends. They were making some mud pies and having a great old time. And then I called them in because it was time to help me make some lunch. And so I said, hey, John, don't forget to go and wash your hands before you go and make me that salad that you were talking about before, because we've got to make sure that we get those germs off of our hands and that dirt that you've been playing in so that I can have some healthy food and make sure that we all stay safe and healthy. So anyone else want to give it a try? All right, I won't put anybody on the spot, but point being is that sorry, Sandra. um, Point being is that it's another way to have some fun with our kids, show them the picture, have them think of a story, tell that story. And again, you can combine all of these together if you want. Um, and you can make one big long story that kind of hits all of the points that you want to get. But again, the idea being that we know when we're supposed to do it. And to Amelia, tab S6, right, how to wash our hands, I'm going to come to that in just a moment. So here's just another poster that I borrowed from the CDC that kind of is aiming towards kids. You know, the primary times after using the bathroom, coughing, sneezing, blowing your nose. Just when your hands look dirty, go ahead and wash your hands after touching our animals in our classroom, before eating, after playing outside. So again, same core messages. These are the things that we want to aim for. So that's how we can kind of get our kiddos and our families to understand why we want to wash our hands or when we want to wash our hands. What I want to show you next, and this actually came through my Instagram feed not too long ago, to help our kids kind of understand how important soap and hand washing is. I saw this video about using pepper in a cup or a bowl or plate of water in the roll of soap that I thought is a great way to kind of help our kids understand the value of washing our hands. So I'm going to show you this video, and then if you got any questions or comments afterwards, we can talk about it.
Hi, Kelly. My name is Amanda Lorenzo, a pre-K teacher in Miami, Florida. I think that teaching is so important, and I think that any age is a great age to introduce them to experiments and different projects like the one I did with the pepper. Dip your finger inside the virus water. Okay. Did the virus move at all? Did any of the pepper flakes move? No. No, right? Okay. Now, Isa, take out your finger. Do you see any virus on your finger? Any pepper on your finger? Yes. Yes. Okay. Now, we don't want the virus on our finger, right, you guys? So, Isa, can I ask you to dip your finger in soap, clean your finger? Okay. This is the importance of how we wash our hands. Now, Isa, does your finger have soap in it? Yes. Okay. Now, can you dip your finger back in the virus? Do you see that? You guys saw that? You see how important it is to wash our hands? Kids, even as young as 4 and 5 years old, are sponges and they grasp everything and they're aware of everything that they're learning. I was on TikTok and I was just looking for different ideas to do with my classroom to spread awareness of hand washing and kind of everything that's going on in the world. I wish I could have recorded the shock on their faces when they realized that the pepper moved away, the virus moved away from the soap. And really anyone can benefit from these kinds of projects and experiments. I had amazing teachers growing up and I saw the way that they shaped the young minds and the minds of my classmates. So I wanted to do the same for my future kids and my kids now. So thank you so much. I hope you see this and stay safe.
So that's a super easy way to just really kind of like get that concept into our kids' heads, right? I love it. I mean, it's so simple. And again, kids are then going to be like, oh, wow, yeah, soap, that's what it does. Germs do not like soap. I had hoped to have an example of this one. Yeah, so it was pepper and water, Naomi. So you basically just get a little plate of water, put a bunch of pepper on there so it covers the top of the water, and you just have the kids kind of dip their finger into the water with the pepper and they can see that it's stuck, and then they go and put it into the soap, and then the soap pushes the pepper away, and it just is a beautiful way of really showing them that power of soap. So another activity that is really powerful, but it does have some costs associated with it. There's this cool thing called glow germ. And basically what it is you have you buy this product and you get a black light, and you rub the glow germ or the powder onto your hands, and you show the black light, and the black light will then kind of illuminate that powder to again show the concept of germs. And then what you do is you have the kids go and wash their hands. They do it the way that they normally do it, which may or may not be good. And then they come back and they put the black light again to show how well they've been able to wash their hands. And so again, I was hoping to do a demonstration of this. I couldn't get the glow germ in time, and plus it's kind of really hard to do this visual on a Zoom meeting. But take a look at GlowGerm if you've got the resources and the interest, because this is another one that's really powerful, similar to that the pepper in the water. So just another idea that you can run. The other thing that I want to emphasize is not just like when do we wash our hands and the power of soap in washing our hands, but making sure that we're doing it appropriately, right? So, there is what the evidence shows us is that a minimum of 20 seconds of hand washing is essential to making sure that we clean our hands well. And so the steps that are recommended by the World Health Organization and others is that get your water on, use that soap to get the lather going, and then you start with a palm to palm, right? So as you're doing your palm to palm, you then move to the back of your hand, right? Spread those fingers out, make sure you're getting the back of the hand. And then you want to actually rub it around your thumb, make sure that you're getting that thumb nice and clean. And then you're going to lace it between your fingers, right? We don't often do a really good job of getting between our fingers. So make sure we do that. If you really want to get into it, push it down into your wrists. And then the last thing is to do your fingernails, right? And so what they recommend is you flatten your palm and you just rub the tips of your fingers into your palm to make sure that you get it all. You want to do that in about 20 seconds. So the question is, how do you make sure that it's 20 seconds? Are you going to sit there and say 1, 2, 3? No, that's hard. And most of our kids are going to lose their patience doing that. So one of the recommendations that we've always done, there you go, sing your ABCs because it lasts 20 seconds. Some people will say sing happy birthday twice because that'll get you through it. Well, I propose that you should actually write your own songs and make it a little bit fun. So during the beginning, early days of the COVID-19 pandemic, I recruited my 2 little boys to help me write a song and perform our song. And I want to show that to you here today, and then maybe pose a challenge to you all to come up with your own 20-second hand washing song. So hopefully you enjoy the Rosenfeld Boys. This is the official launch of the Hand Washing Song Challenge, coming at you from the Rosenfeld Boys. 1, 2, 3. Yeah, I'm gonna take my hands to the bathroom sink. I'm gonna wash till they're nice and clean. I got the water tap turned on, got the soap in my palm, gonna scrub my hands clean of that COVID-19. Tell me to scrub for 20 seconds and the germs will all be gone. Gotta get between my fingers, scrub the bubbles in my palm. Ain't no virus get inside me, can't get inside me. When I wash my hands with soap, can't get inside me. Yeah, mic drop. So, again, just a fun activity, something you can do with your kids. It's just another way to kind of help ingrain the messages that you're talking about of when to wash your hands and how to wash your hands, and it gives us that reminder to do it for 20 seconds. I was going to have you guys do some work together to make your own songs. I think I'm going to go ahead and kind of skip that part. Although if you would like to make a song with your kiddos and you want to send it over to me and our Health Confianza team, we would love to get that onto our website, share it on our social media platforms, share the world about the songs that you guys make. So feel free to engage in that. I'm going to go ahead and start to wrap us up here because I don't want to go much longer than the hour. So our team has also pulled together a bunch of healthy tips, like helping to keep the germs away. So this is another poster that we've developed that we'd be happy to share with all the registrants and participants in today's session. So promoting vaccination, eating healthy, covering our mouths, getting sleep. There's our clean hands there, keeping our surfaces clean, keeping our hands off of our faces, man. I know I struggle with this with my beard. I'm constantly scratching my face, telling my kids to not get their hands off their face, and I can't do it myself. But also making sure that we're spending time relaxing and resting and reducing stress in our lives. And so, again, this is another resource that we'd be happy to share with folks within the KLRN family and network. The last thing that I want to just quickly share in our last few minutes together is I wanted to talk a little bit about this idea of the Community Health Club, which is a model of peer-to-peer education that is at the center of one of our community-based approaches. It's actually a model that we're implementing in SAISD campuses right now, bringing people together to share knowledge, share resources, and come up with solutions to commonly held problems. So if you'll bear with me, I want to just show you a quick promotional video that my team has pulled together to kind of explain this model, and then we'll wrap this up with some question and answer. Goal of the club is to create that sense of community so that community can drive change within the neighborhoods that they are living in. And so that's why I feel at this point in time, there's an opportunity to reconnect ourselves after the COVID-19 pandemic, where we've had to go into our homes, leave our workspaces, and socially isolate, to reconnect those social bonds, help us address our mental wellness, help us address our social well-being, and ultimately help us address physical well-being at the same time.
Grew up down the street, down Castro Hill Road. You always hear people saying, you need to get out, you need to get out. And it's like, yeah, okay, we can get out and come back and try to make a difference. And that's kind of where my mindset is. In these times, coming out of a pandemic, I think people were isolated. People stayed at home because that's what they were told to do for their, safety and for their health. So when they have health clubs like this, they come together with people that live where they live, that have been through the things that they've been through. And that's just easier for people to come out, be part of a community again. And that's what the health club offers. It's just a space for people to come in, be with others, be with friends, and just have a good time. Really, that's just what the whole club's about.
I have been a part of community organizing for many years. For me, this is like the work that I'm doing. I'm part of neighborhoods just like these. I was raised up in communities just like these. So like, I've made a home out of these communities. Biggest challenge is building trust. What I do is very basic for building trust. It's making sure that I'm visible as much as possible, showing up as much as possible. So like a lot of people that want to show up to an organization and just volunteer and then leave. For me, like it's not just about volunteering, it's about hanging out, it's about making friends, it's about finding similar stories, finding middle grounds, becoming integrated like as a friend.
It was great to see everybody back, not even alone. So it was very lonely, I mean, it was very, very lonely. There's a few of us here that we come in like at 7:45, and we don't need each other 1 o'clock, and we come every day. We come every day. I like it here, It's like a family to me because I lost a lot of my family already. I would just stay home and sleep, watch TV, or just clean the house. I'm used to coming here, so I just stopped going. But like here, like they do some movement and things like that, so that keeps me going. When one hurts, we all hurt, We all laugh, It's fun. This is my San Antonio, and this is my house of neighborly where I come and enjoy myself here. In my family, I have doctors, I have nurses, and sometimes they don't have time to explain things to me. We learn about COVID and vaccines. I have all my vaccines, Here I learn a lot about dementia, about falling down. I learned because I asked.
Traditional health education and public health programs oftentimes are presented as classrooms, as learning, as something that we have to get ourselves through. The goal of a club is to go and have fun, to play games, to act silly, to sing songs, to do sketches and skits that make us feel slightly uncomfortable because there's learning in that discomfort. So part of it is the fun that you can have when you do this. Part of it is the ease of the pressure on you to have to deliver information every single time because we're tapping into the collective knowledge of our neighborhood through the club model. And you can create co-facilitators, co-educators from within your club that can then help you deliver information in a culturally and linguistically appropriate way. And at the end of the day, I still believe wholeheartedly that it makes jobs easier because we're not having to go to 50 separate individuals, but we can go and have 2 clubs that get us 25 people at one time, increasing our reach and allowing those individuals to reach out into their families and into their communities farther to further disseminate our information and engage people in health and wellness. I'm excited about the opportunity to rebuild community, help people reconnect with themselves and their community around them, and ultimately rebuild trust between our communities and our healthcare and social service systems that have been working so hard to promote health equity.
Community health workers make the world go round. Becoming a facilitator for health clubs is like all the on-the-ground training that you can ever ask for.
So working with clubs has been one of the best things I've done in my professional career, and I just think a lot of people would benefit and get the same joy that I have out of it if they were to try it.
This is like one of the best trainings for anybody who wants to get into addressing communities of all kinds.
One of the hardest parts of public health engagement, of health behavior promotion, is bringing people together to learn and to take action with that knowledge. And the model gives us that opportunity, right? Because we all want to be part of something bigger than ourselves. So with that, I'm going to conclude. And so I'm hoping that I showed you a little bit of the power of why hand washing is important, and some activities that you can bring, like I said, into your classrooms, into your work, into your after school programs, into your families to kind of help promote hand washing, the whens, the hows, the whys, and to just kind of help us think about how do we continue to promote some of the easiest practices to prevent respiratory infections, which are leading causes of illness amongst our children. If you've got questions, if you'd like to engage more with Health Confianza, please reach out to us at the contact information on the slide. You can also follow us on our social media platforms. Again, if you have a song that you want to record with your kiddos and share it with us, we will happily promote it for you. If you'd like to start a club, we would happily collaborate with you. So I want to thank you all for your time, your attention and participation, and I'd be happy to stick around to answer questions or have a conversation with you all. So thank you so much.
Thank you so much, Dr. Rosenfeld. That's an excellent presentation. Here in the chat, I can see there's a lot of participation. That they loved your presentation, and Ashley shared your experience as an educator really shines through as a presenter. Loved all the great info, said Sonia. Carolyn, thank you for an amazing presentation. Noemi, thank you, an amazing training. Thank you, Dr. Rosenfeld.
Yeah, thank you all. And Sandra, I see your message. I'll ask one of my CHW team members if they're familiar with any Tai Chi places in New Braunfels. So I'll try to get back to you on that.
Wonderful. Thank you. Thank you so very much for joining us and sharing your information with us. And we hope to collaborate with you again in the future. So we would love that. This is excellent information. And we'll be sure to keep in touch on the posters as well. And thank you for including information on how we can get involved in being a part of Health Confianza and learning more. Thank you so much, Dr. Rosenfeld. We appreciate your time.
Yeah, of course. Thank you so much. It was so good to be with you all. Again, please feel free to reach out if we can help out in any way. My dogs are freaking out, so I'm going to go get them outdoors before they really disrupt this meeting. So I want to wish you all a wonderful evening, a happy Easter, and a healthy spring into summer.
Thank you.
Thank you. You as well.
Thank you.
Hi, friends. Can you all see the screen with the KLRN resources for educators and families? Great. Thank you so much. What a great presentation. And timely, right? It's always important to know about the importance of washing our hands, but especially now as we're making sure that we can stay safe, and if it's change of the seasons, this is excellent. So thank you all so much for being a part of Dr. Rosenfeld's presentation. As he mentioned earlier, he did provide a copy of the slides, so I will be emailing that to y'all as well this evening, and in addition to the Healthy Kids slides. So we're going to jump on over to our KLRN resources. Friends, if you haven't had a chance to look at, oh, thank you so much for including your email. Thank you, Miss Kathy. To sign up for Bright by Text, I definitely encourage you to look into it. We would love to have you join. Essentially, it is a text program. It's free of charge. All you need to do is text KLRN to 274448. You can do that in English or Spanish, and you will get activity ideas, games, resources. If you have a very young child, you can get information on milestones, developmental milestones to look forward to. If, like me, you have a child who's older, you'll get some great advice about community events happening in San Antonio and specifically in your zip code. So I definitely encourage you to sign up for this. This program is geared for children from 0 all the way to 18, so the entire childhood. Can also sign up on this bit.ly link and by scanning the QR code or by texting directly KLRN to 274448. So thanks so much. Our Learn at Home page, as always, is updated with information. And okay, some big news that's happening. You all know that the eclipse is happening. Yay! If you haven't had a chance to do so, we encourage you to look at our blog. So I'm going to show you just where to find that. If you go to klrn.org and just click on the search bar and put eclipse. So you can see all the things I've searched for here. Let me try that again. Eclipse. We have a blog post that that we've put together, and our wonderful friend Ian has been updating very frequently for us, so it's very helpful. We are excited to share with you about all of the different information that's happening about the eclipses, about the eclipse. So there's going to be, there was one in October, that was the annular eclipse, and that was the one that kind of looked like it's also known as the Ring of Fire. You can see the outline of the sun eclipsed by the moon. So basically it's dark in the center and fiery looking on the outside, right? This upcoming one is going to be a total eclipse, which is essentially a very dramatic and amazing experience. I have never seen one before in real life. So we will be in the city of San Antonio will have totality in some parts of the city. And what that means is there's a path of totality, which means these are the areas of town where you can see it, and then outside of that, where you won't be able to see it. You can put into just Google or anywhere. If you go to the Great American Eclipse, that's one place you can find information on this. And you can put in your zip code, am I in totality, or your address even, to find out whether you'll be able to see it or not. Now, that being said, it's never safe to look at the sun without protective eye gear, especially during an eclipse. We want to make sure that we're using eclipse glasses. So if that's something that you need, perhaps your school already has them, perhaps not, please feel free to reach out to me. If I can give you a visual of kind of the city of San Antonio and where is going to be in the path of totality and where it is not, if you were to visualize the city of San Antonio as a clock, right? And if you were to say, okay, I'm going to go from 7 o'clock to 1 o'clock, but I'm going to skip the middle of the clock. That's basically where the path of totality is going to be. So places like SeaWorld, UTSA, Helotes, I believe New Braunfels, now that we're outside of San Antonio, Bulverde, Bernie, Uvalde. There are different areas within San Antonio and then outside of. Thank you so much. I feel so silly. I'm so sorry. I was just talking and talking and talking, and I did not turn my mic back on. I'm so sorry, friends. Thank you for your patience. Can you hear me now? I hope. Yes. I'm so sorry. Thank you for letting me know. I feel very silly. Thank you. What a great presentation from our friend Dr. Rosenfeld. I am very much behind on everything I was saying. I apologize. So I did want to let you know. That was an excellent presentation, very timely, and I'm so glad that y'all were here for it. Thank you for being a part of this evening's session. I really, really appreciate it. Dr. Rosenfeld's slides are going to be available to you after this evening's session, as well as this evening's slides with the Healthy Kids Project information. And I wanted to let you all know about the eclipse. So there's going to be an eclipse happening on April the 8th. Oh, okay. Thank you. Bless you. Thank you, Ms. Sandra. Sorry about that. So totality is, I must have just bumped the microphone. Thank you. I'm sorry about that. Totality will be only in part of San Antonio. So last time around in October, when we had the annular eclipse that looked like a ring of fire, at that point, all of San Antonio could see it, right? But this path of totality, it's almost like it is a ribbon that is going through about a third of San Antonio. And it would be like if you're looking at a clock and you're going from 7 o'clock to 1 o'clock and kind of skipping the middle of the clock. So the eclipse will not be visible in totality in downtown, right? So our friends over at the Scobie Education Center let us know you're not going to be able to see the eclipse in its full glory from Scobie Education Center. You won't be able to see it from KLRN. However, if you're in a place like Helotes or nearby UTSA, Wolf Stadium, we have a big event going on there. So we hope that you can join us for that. I'll be glad to send you information on that where you can register. It is absolutely free. We ask that you coordinate with transportation and lunches, but the entire event itself is free, and eclipse classes will be provided to everybody who's joining that. So I hope that you can join us. It's a big, cool event. And essentially, I've never seen a total eclipse before in real life. It's supposed to be absolutely incredible. Basically, it's going to look like a black dot in the sky with the corona of the sun around it. So it'll almost look like white flames or white feathers coming out from behind it. It's really spectacular. So I encourage you to check that out. It is going to be visible here in San Antonio, but only for part of San Antonio and for less time than in places like Uvalde or New Braunfels or Helotes. So it's kind of outside of town where it's got a longer period of visibility. It's also going to be available for about 20 to 30 seconds in the area of where the Wolf Stadium is located. However, 20 to 30 seconds is still going to be incredible for a really, really amazing once-in-a-lifetime event like that. If you need eclipse classes, if your school needs eclipse classes, please do let us know. We may be able to help you with that. So please don't hesitate to reach out to me. Okay, so I'm going to move along. You can reach out to any of us on the education team at education@klrn.org. And so thinking about healthy habits to stay healthy, right? Dr. Rosenfeld had some excellent advice for how to stay healthy by washing your hands. As you're looking at ways to continue to stay healthy or to maybe get back into the springtime healthy routines, think about 3 to 5 exercises that you enjoy, right? So your favorite things to do, that might be taking a walk, that might be taking your dog for a walk, right? It could be doing yoga, whatever it is that you enjoy, find those and list 3 to 5 things that you enjoy, and then start building a schedule for yourself, something that's manageable, right? It might be starting with 10 minutes, maybe a day, right? And then you could move it to 10 minutes in the morning, 10 minutes in the evening, 10 minutes in the middle of the day. And right there, you've got a half an hour of exercise in your day, right? So you can put it in pieces like that. I know it's very hard to find time in our days with very busy schedules. So thinking about ways that we can put that together and to connect that to what Dr. Rosenfeld was saying too, we want to make sure that we have the opportunity to have fun, right? Build it into our day, not feeling like it's something that we have to do, but something that we enjoy doing. So thinking about things that you enjoy. Maybe it's having a dance party, right? That's a lot of fun. List 3 to 5 of your favorite fruits and vegetables. This one can be really helpful for when we're working with our littles, right? And we find something that they enjoy. Maybe they really, really love a particular fruit or vegetable or both. Finding a way to incorporate that into every day, right? Can change it up a little. We can have celery sticks with cream cheese or with peanut butter or sunflower seed butter. Maybe we could have oranges that are in just as is, right? We can take that with us as a snack, or maybe we can draw a face on the rind and decorate it and have some fun with it, right? So there's lots of different things that we could do. So as we're looking at this list, if you could share some of your favorite things here. If you'd like to list an exercise, one or more that you enjoy, a favorite fruit or vegetable that you enjoy, and a favorite relaxation activity. Now, here's a big one too. Our mental health is really important. List 5 things. That's a bigger number because I really want you to stretch yourself, because I know there's many more than 5 things that make you special and likable and wonderful. But list 5 things about yourself that you like, that you do well, that you are proud of. Think about a typical day, make a schedule built around that, and build in time for a hobby. So I would love to hear what you have to say. Could you share that with me in the chat? Or you can unmute yourself too. You can share any one or several of all of these things. Maybe it's an exercise that you enjoy, a favorite fruit or vegetable, favorite relaxation activity, or something about yourself that you like. I will get started. And I want to hear what you have to say too, right? An exercise that I enjoy is walking. I was just talking with my teammate about that the other day. I feel like I get bored if I'm doing exercises in one space and I'm indoors, right? Oh, I love that. Thank you, Miss Alicia. Going to the park with the kids. Yes. And it's beautiful weather for that. I love that. Miss Ashley, I love strawberries, dragon fruit, and peaches. Yum. Making smoothies is our favorite thing to do at home. It's an easy way to make my littles eat fruit. Oh, I love it. That's so smart and easy to ingest, right? We don't have to worry about like choking hazard because it's nice and it's smooth. It's like a milkshake. I like salads. Wonderful. Love eating fresh fruit. Great. Working in the garden. Oh my goodness, that's wonderful. For sure. Walking my cats every day after work. Oh, that's amazing. That's really nice. Awesome. Thank you for sharing that. Oh, I love it. Plums and greens. Yum. That's so good for you. You know, back when I was little, growing up in California, we had a green plum tree and it was so good. I love running, blueberries, and fishing. Oh, how fun. Listening to music. Yes, that is wonderful for exercising and relaxing and just making you feel good, right? When you find a song that you really, really love, and doesn't that just like make you feel better? Like, I was just listening to a playlist while I was working today, and I was like, okay, I'm ready to keep going, and had all these ideas flowing for the next things that I wanted to work on. So I love that. Thank you all so much for sharing that. Very, very cool. I love it. Now, if you feel comfortable doing so, silly dances with the kids, I love that. Yes, awesome. Please share something about yourself that you feel proud of. I love baking and trying new recipes. Me too, Miss Amelia. I love to bake and to try new things. A fun activity that we've been promoting is called At Home Master Chef. It's actually from the Watt Watchers website, but this is absolutely something that you could include in with the recipes that we're trying here through Healthy Kids, or just in general, right? It's sort of a challenge, but a fun one. So basically what you do is you look through your fridge and your pantry, just wherever you're keeping things that, bread box, that are things that are maybe about to go bad. And when I say that, I don't mean like, my sweet mom, she would always she kind of took it to a whole other level, right? Of like, I don't want to waste. So if there's mold on the bread, she'd cut the mold off the bread. And it's like, oh, that's probably not good to eat. But, as far as this activity goes, we're looking for things that are like, okay, I have some, let's say, strawberries in the fridge, right? And the next time I'm going to go to the store, I'm going to get some more strawberries. These strawberries are still good to eat, but they're getting to that point where they're like a little wrinkly. What could we do with that? Could we turn that into a smoothie, right? Could we turn that into something where we blend it and add some vinegar and oil and maybe spices, and we turn that into a salad dressing, right? Trying some new things and kind of thinking outside of the box and turning it into something else, so that we're not wasting it. I can tell you from experience, most of the time this turns out really well and you wind up with a recipe that you're like, oh, that's going to go into the rotation. I'm going to continue that. Sometimes it doesn't. I definitely speak from experience, right? Sometimes it's like, okay, that wasn't great, but we're going to finish it up. And then I'm not going to make that combination happen again. But most of the time it's finding something and you're like, wow, that's pretty cool. So thank you, friends. I love that you shared that with me. I would also love to hear what you like about yourself. If you feel comfortable sharing one thing about yourself that you like, or that you do well, or that you are proud of. I think something about myself that I like is I will try very hard to make sure that nobody is excluded, right? So I guess another way to say that is I want to make sure that everybody's included. That's something about myself that I like and that I'm proud of. So I encourage you to do the same because I want to hear about the awesome things that you do. I know you're amazing people. Enjoy working with children, tutoring, and teaching Sunday school. That's beautiful, Miss Sandra. Thank you for that. You have a very important job. What you do makes a really positive difference in the world, my friends. I'm so honored that I get to listen to the ideas that you share and to just spend time learning from you all. Okay, friends, I'm not going to put you on the spot, but if you change, oh, make people laugh. Thank you, Miss Alicia. I love that. I pride myself in being the best and whatever I do, and I love my babies and cleaning. That is beautiful. I love that. That's really, really special. You know, putting your best foot forward, making sure that you're doing your best at whatever you do. I'm proud of all my accomplishments throughout my life. Wonderful. I'm proud of them starting a little free library. That's awesome, Miss Jessica. That's so nice. That always makes me smile to see those in the neighborhood. I love that. That's beautiful. And I'm very proud of you all. Thank you for sharing that. That means a lot. If you think of something else, I want to hear it. Please do join. Okay, I'm going to share a little bit about the Healthy Kids Project with you. So as we know, the Healthy Kids Project, there's so much that we can pull from here, right? One of my favorite things about the program is that it is so flexible. So it's a free program that promotes health and well-being. It's geared for families and educators of children between 0 and 9 years of age. But that being said, it's absolutely applicable for, I think, all ages, right? There's a lot of good advice here talking about making time to sleep, making time to exercise, making time to try new foods, making time to drink enough water, being kind to ourselves and to others. So it's an overall well-being, right? So here's where we can take a look at more of it. I do want to share with you, since I've got some fellow chefs in the audience here, in the participant group, and some fellow gardeners. This is something that I would like to do better at. I'd love to show a few videos that we put together with our friends at the San Antonio Food Bank. So we have gardening tips and we also have recipe breaks. So just to change it up a little bit, we're going to take a look at a few of these. I also want to let you know, be on the lookout. We are looking at putting some videos on here that have to do with yoga, mindfulness, and relaxation. So please be on the lookout for that as well, and feel free to use these in your classroom. But for right now, we're going to take a look at the gardening tips. Each one of these is just a minute long. This is with our friend, Miss Angela from the San Antonio Food Bank. Let's check it out.
Hi, I'm Angela McDermott with the San Antonio Food Bank. I'm going to talk to you today about composting. This is one of the compost bins that we use. This is a compost tumbler. This is utilized by turning it around, and I'm going to open it up so you can see what's inside. Compost is great to use in your garden because it helps to add lots of healthy nutrients as well as moisture into your soil. You want to put your compost in your garden before you begin planting. Composting can be really easy. Just make sure you've got all of your materials together. You've got your browns and your greens. Browns, that's your leaves, potting soil that we've used, and then also some of the manure from our animals, like our goats and our chickens. And your greens being your kitchen waste or your garden waste materials. and you want to make sure that you've got a ratio of 3 to 1. So that's how we compost here at the San Antonio Food Bank. Join me next time for another gardening tip. Visit klrn.org/healthykids.
So that's a really good one on composting. How many of y'all do that? Do any of you do composting? That's something that I'm trying to get started with, and I think she makes it very very manageable. If you've been with us for some previous courses, Miss Angela did teach a course on composting and starting a garden with kiddos. It's excellent. So if you'd like for me to send that your way, I certainly can. Oh yeah, absolutely. This absolutely, Miss Ashley. Thank you so much. Yeah, this is talking about she has ones on composting, herbs, cover crops, and plant spacing. And yes, you are correct. These are all on the Healthy Kids page of klrn.org. So this is the first thing you see on the page. You just scroll down and then you'll see this window of 4 different options here. Yeah, absolutely. Thank you. Let's watch this one on herbs.
Hi friends, and welcome to Healthy Kids. I'm Angela with the San Antonio Food Bank, and today we're going to talk about planting edible herbs. Edible herbs are a great addition to any garden space. Herbs require less maintenance than other edible crops and are easy to grow from seeds. Lavender has a colorful purple flower, and it attracts bees and butterflies to your garden. Oregano is a great ground cover, and it is an herb used on pizza. Mint is used as a flavoring in bubble gum. Rosemary is used for fragrance in soap, shampoo, and seasoning for food. Parsley can be sprinkled on almost everything from grilled foods to salads. Some herbs like marjoram, sage, and thyme are used in medicines. Once the herbs are planted and established, these plants will last many seasons in the same area or container. Keep growing, friends. See you next time. Visit klrn.org/healthykids.
So I like that one a lot too, because the kiddos are also being able to having the opportunity, to learn about the different types of herbs that are edible and how they can be used, right? So let's take a look now at cover crops. This one's really important, especially in we have a drier climate here in San Antonio, and this is helpful for preventing soil erosion. So sometimes when we have been through droughts, right, and the ground will start to get dry and hard, or if we get a lot of rain, on the opposite side of the coin, if we get a lot of rain, how the dirt will either, if it's very dry, kind of blow away, or if it is very wet and we get a ton of rain, it'll get washed away, right? Well, cover crops help to prevent that and to prevent soil erosion. So let's check this out with Miss Angela. Oops, sorry.
Hi friends, and welcome to Healthy Kids. I'm Angela with the San Antonio Food Bank, and I'm here to talk about cover crops. Cover crops are an excellent addition to your garden when you want to give your soil a rest, but don't want to come back to hard, dry soil that is covered in weeds. Cover crops increase water absorption in your soil. Grasses like rye, wheat, and oats are cover crops which add organic matter and control erosion of the soil. Peas and clovers add nitrogen, which is a fertilizer for the soil. Cover crops attract pollinators and beneficial insects like butterflies, bees, and ladybugs to your garden. Cover crops are typically planted in early spring or early fall and grow through the summer or winter, depending on the plants you choose. Keep growing, friends, and see you next time. For gardening tips and more ideas, visit klrn.org/healthykids.
So that's helpful information, right? So I love that all of this is a part of it. Another big part of when we're looking at how to plant our crops, whether that is our plants, whether that's something large like pumpkins, or whether it's a smaller plant that will grow into a larger plant, or even whether it's a seed, we want to be mindful of how big it's going to get when it's a fully grown plant.
Hi friends, and welcome to Healthy Kids. I'm Angela with the San Antonio Food Bank, and today we're going to talk about plant spacing. Proper plant spacing is important. Plants need enough room to grow without being overcrowded, but if plants are spaced too far apart, it could create places for weeds to grow. seeds start small but can grow into large plants as they mature. Watermelons are very large plants, and so are pumpkins. Both need 2 to 4 feet of room between each plant. Tomatoes are tall plants, and so are peas. Both of these plants need between 4 to 12 inches apart. Broccoli and cauliflower have large leaves and require at least 1 foot between each plant. Onions, radishes, and carrots require 3 to 4 inches between plants. Be sure to check the seed packets for recommendations on how to space the plants in your garden. Keep growing, friends. See you next time. Visit klrn.org/healthykids.
So thank you for joining me for that. So that's a little bit about a way that we can stay healthy. And I see in the chat here that my friends are saying that you enjoy gardening and being outside. That's a wonderful way to reconnect with nature, get outside, get some fresh air, get some vitamin D from the sunshine, and to help something grow. There's something very, I think, very helpful to our mental health to watch something and nurture something as it grows, right? So if we plant a seed and watch it grow, that's just beautiful. We're taking care of it, we're helping a plant to grow. So really, really lovely ideas there, and ways that you can grow a vegetable garden, or even learn more about composting. So thank you for joining me for that. We also have recipe breaks here. So these are with Miss Ethel. We have the pumpkin bites recipe, the hydro pop surprise recipe, peachy keen salsa, happy root chips, which is a great alternative to fried potato chips. These are actually baked. Family fun do, which if you haven't tried, I encourage you to check it out. Plus, the choices for dipping options are unique, and I think that you'll like them. And cheesy brock and mac. Now, when these were originally put together, we thought, this is great to kind of connect to different times of the year, perhaps with what's in season, and also pumpkin bites going back to school, but also like the fall, right? These are a great choice, and they are very filling, they're very healthy, and you'll see that many of these recipes have very little or no sugar in them. Hydro Pop Surprise in particular, we'll take a look at this one in just a second. Hydro Pop Surprise is it's like creating a very healthy paleta. So it's made with cucumbers, watermelon, coconut water, and lime juice. Now, if you're like me and you start on the recipe and say, oh boy, this is fun, I've got watermelon and I've got some limes, I'm going to go ahead and make this, and then realize after you're done putting all the other ingredients in the blender that you don't have coconut water, I will let you know that this works out just fine with regular water. The benefit of the coconut water is that it serves as natural electrolytes. So instead of having a sports drink, you'll be able to get the electrolytes, if that's something that you're needing, without the extra sugar that is found in sports drinks. Peachy keen salsa is a great way to incorporate lots of different fruits and vegetables together. Happy root chips, lots of fun. So let's check these out.
Hey friends, welcome to Healthy Kids. It's back to school time, which means we need a healthy snack that'll keep us energized and ready to learn. I've got the perfect recipe, pumpkin bites. We're gonna start with a bowl of oats. We're gonna add some melted peanut butter with honey into our oats. Be careful, it'll be hot. And then we can add some vanilla extract, some pumpkin puree, and then raisins or any dried fruit of your choice. And lastly, a little bit of pumpkin spice. We're gonna mix this all together with our spatula, and it'll look a little something like this. We're ready to make the bites. Now we're just gonna scoop some up, roll it up into a bite-sized ball until it looks like this. Now you're ready to go back to school. Stay healthy, friends. See you next time. For the full recipe and more recipe ideas, visit klrn.org/healthykids.
So quick question, if you'd like to answer, how many of you have made these already? My family and I made them. They're really, really good. They keep for a few days in the fridge in a covered container. So I encourage you to check that out. If you're not really a fan of different aspects of the recipe, like let's say you're not a fan of peanut butter, or you can't have peanut butter, you're welcome to use sunflower seed butter. You can also use craisins or dried cranberries in, oh, there you go. I love that, Miss Alicia. I've made something similar, but they don't last because we eat them fast. Wonderful, very healthy. Oh, thank you, Miss Raquel. They are really tasty. One of the things that I like is it's kind of modifiable, right? So if there's different dried fruit that you'd like to put in there instead, you can absolutely do that. Oh, thank you. Oh, thank you so much, Miss Ashley. Yes, yes, absolutely. The Hydro Pop is really fun. And just as a note, if you don't have time to freeze it, which we didn't, we actually didn't turn them into the pops. We used it like an aguas frescas, and it was really aguas frescas, excuse me. It was delicious. It was very satisfying, and it's neat to be able to see how all of the ingredients blend together. Thank you, friends. I appreciate your support and encouragement here. Let's check it out. Oh, let me try that again. There we go.
Hey friends, welcome to Healthy Kids. It is summertime, which means we need to stay hydrated, and I've got the perfect recipe for you, Hydro Pops. Let's get started. We already have some chopped up watermelon and cucumber. We're gonna add that to our blender. We're gonna add some coconut water, a little bit of lime juice, and then we are ready to blend. That's gonna take about 5 to 10 seconds. Just get it to the consistency you like. Now, we're ready to pour this into some empty cups or a popsicle mold. Let it freeze for about 6 hours or more, and you'll get something just like that. Now we're ready to stay cool. Stay healthy, friends. See you next.
That recipe is a lot of fun, and I encourage you to change it up too. If there's something that you'd like or you'd like to add additional fruit in there, you absolutely could do that too. Another fun thing to do is look at things that you really enjoy. I heard that some of my friends in the chat enjoy blueberries and strawberries, and there's actually a great recipe here on PBS Kids that I'd like to show you. And this is called, let me see here. I'm sorry. My internet's running a little bit slowly. But Molly of Denali, are you all familiar with that show? She has a great recipe for blueberry milk. And what that is, and this is great, especially living here in Texas, if you keep some of your fresh fruit, because fresh fruit is available a lot of the year around, right? But if you buy the fresh fruit, you wash it and you freeze it so you can have it for later in the year when it's not in season, so you can still enjoy it. It's taking just a little bit of time. It's a great way to be able to utilize that because you don't have to wait for it to thaw. This is Spring into Family Brunch with 5 cool recipes. And I wanted to kind of connect this one to our Hydro Pop recipe. So there's pink lemonade. It's a lot of fun. Molly of Denali's blueberry milk. And I'm glad to include this in the follow-up email as well for you. What this is just milk and frozen blueberries. And I think they recommend like a teaspoon of sugar. You could use that, or you could choose not to. You also don't have to use milk. You could use a non-dairy substitute, maybe like oat milk. And let's check it out. So I hope you like that. That one is really easy and fun. And I like that there is so much flexibility to these recipes too, right? So blueberries are one of Molly's favorites on the show. I love blueberries too. What if you have something else in your freezer? What if you have frozen cherries or you have frozen strawberries or you have frozen raspberries or frozen peaches, right? Could you use that? Absolutely. Could you add some spices to it if you wanted to, like maybe a little bit of cinnamon, right? Oh, thank you. I think so too, Ms. Raquel. I've tried it at home. It is good. It's interesting. And I've never had bubble tea. But I know that that's supposed to have like kind of a chewy texture to it too. So I would imagine that it kind of has a similar texture, but I can't say for certain because I've never had bubble tea. I've always wanted to try it, but I haven't had it yet. But I imagine that the little blueberries in this would kind of be like um an alternative for that if you don't have that on hand. Oh, thank you. I will. Thank you so much. Another thing that you can do is to make fruit kebabs, excuse me, get creative with veggies. So really just fun things to do together. Ways that you can bake together, my friends that enjoy baking. Creating cute veggie snails. Here's another one. So I'll include this as well. And as you're looking at the recipes, one of the things that, again, not to sound like a broken record, but that I really appreciate is the flexibility of a lot of the recipes, right? Sometimes when I would watch cooking shows, just years ago and see, okay, if that recipe calls for a very obscure ingredient that, maybe I don't have on hand, what else could I use instead? Because I don't like the idea of having to go out shopping for one ingredient. That seems wasteful to me, especially if there's something that I can use in its place, right? So let's say you're looking at this and saying, all right, there's celery stalks, cucumber, cherry tomato, small green pepper. What if you don't have that? Maybe you could leave it out, or you could use something else in its place. You could use a carrot. So very flexible recipes. Or if there's something that your child, isn't a fan of, or it has tried and it said, no, I'm not keen on it, or perhaps, something that they can't have, you can always modify that. But I do want to show you the finished product here. Look at how cool that is. A cute veggie snail. So lots of fun ways to help our kiddos to eat their veggies. Adding baked goods to our brunches. Baked goods are really fun, right? Right, my friends? Thank you. I thought so too. So making banana bread, spiced oatmeal muffins, making foods that are inspired by eggs, lots of things to do here. So I encourage you to check that out. It's a really cool website, and I'll be absolutely sure to include that in the follow-up email. Oh, thank you. Thank you, Miss Terry. Wonderful. My husband says a lot. He's like, I credit you with the fact that I eat vegetables now. I'm like, oh, well, thank you. He's like, growing up, I didn't like to eat vegetables. And as growing up, we had to eat vegetables, but we liked it because my mom was a good gardener. I'm not so much, but my mom really was. I'm trying to work toward that goal of being a better gardener. And she would always make sure that whatever we had, like there was always a vegetable component. Like sometimes there was, more vegetable than anything else, but there's always vegetables. So she got really creative about what she did with it. And she also knew how to grow a lot of them as well. So that was really special and kind of a neat way to connect. So I appreciate you saying that. Thank you so much. Okay, friends, let's take a look. Veggie noodles. Yes. Oh, that's so good. Great idea. Peachy keen salsa. Spirals, yes. Oh my gosh, how fun, right? And that is the shape of pasta, but not pasta, right? Like, are we talking about zucchini, I think? Very cool, very cool. Okay, so let's check out peachy keen salsa. This one's different and cool.
Hey friends, welcome to Healthy Kids. Summertime is just around the corner, which means we're gonna see lots of colorful fruits and veggies. Today's recipe, peachy keen salsa, with our guest, avocado, with lots of healthy fats, good for our brain. Let's get started. We're gonna add some chopped tomato, some chopped onion, we've got our peppers, our special guests, peaches and avocados, and then we're gonna add just a pinch of cilantro, some lime juice, and a pinch of salt and pepper. Now you're just gonna gently mix it together until it looks something like this. Now it's ready to go. You can take it on a picnic or add it to your favorite meal. Stay healthy, friends. See you next time. For the full recipe and more recipe ideas, visit klrn.org/healthykids.
So how did that one sound to you? I thought that sounded fun and different. My friend at work, she and I were talking about that, and she said, "Oh, I'd like to put that on chicken or pork." And I said, "That sounds really good to me." Like my mind went to fish, like a fish taco with the peachy keen salsa. So lots of different ways we could eat that, right? What are some ideas that you guys have? I'd love to hear it. Mango salsa with fish, right? Really similar. Okay, Miss Ashley, you and I were on the same wavelength with that one. Awesome. Awesome. So even thinking about like, how we can use these recipes and, like we were saying earlier, if there's something that you're like, "Oh, you know what? I have this instead," or I like I think I prefer mangoes to peaches. So I would, more than likely have mangoes at the house over peaches. I like peaches though. Thinking about how you can kind of modify that and turn it into something else. There's also recipes for lassis, which are from India. It's sort of like a licuado or a smoothie, right? It's just fruit and yogurt mixed together and some spices sometimes too. So there's lots of different things um that we can make into something that's like a modified version of something else that we might already be enjoying. Happy root chips. Let's check that one out. I know I had a friend ask about that.
Hey friends, and welcome to Healthy Kids. It's springtime, which means lots of root vegetables. Here I've got my purple sweet potato, yams, and my russet potatoes. We're gonna slice those up real thin and let them soak in water with ice for 30 minutes. Once that's ready, we can lay them down in our baking sheet, and with a paper towel or a napkin, we are just gonna make sure that they're nice and dry. Now we're ready to spray them with some oil. And they're ready to bake. We're gonna bake these at 450 degrees for about 12 to 15 minutes until they look something like this. And then they're ready to serve. Stay healthy, friends. See you next time. For the full recipe and more recipe ideas, visit klrn.org/healthykids.
Thank you, friends. So Miss Ashley, I know you're wanting to see that one. This one is really fun, and I can tell you we have tried something similar at home. The soaking it in ice water is really helpful. Oh, hummus dip, great idea, Miss Alicia. And Miss Amelia, I know you had great ideas about baking too. So friends, you all are sharing such great ideas with me, and I really appreciate y'all. Before I forget, because this is important, I'm going to go ahead and put the post survey link in the chat here. And then I am going to, oh, thanks. Oh, that's gonna be wonderful. Send a photo if you would like. We would love to be able to share that maybe on like social media. That would be fun. Our friend Ian, sorry, he does a wonderful job promoting all of the great things that our friends are doing in the community through social media. Let me see here. I've also got the QR code right here. So if you'd like to scan that instead of clicking on the link, either one, they'll both take you to the same place. So I'm going to just leave this up here for a moment so that you can scan that if you want to on your phone, or if you prefer to click on the link, either way. But if you want to go ahead and tackle that now so that we don't risk running out of time later on, because I can talk and talk and talk. Friends, I so enjoy getting to spend time with you, and thank you for always sharing your wonderful ideas and the ways that you work with your kiddos. You're wonderful educators. I appreciate you. Alrighty, friends. So now what I'm going to do is head on back over here. We'll check out Family Fun Do. Now this one's really interesting and cool and different.
Hey friends, welcome to Healthy Kids. It's wintertime, which means I'm craving something warm and good for my heart. I've got the perfect recipe, Family Fun Do. It's real simple. We're gonna start off with some hot milk. You can heat it up on the stovetop or in the microwave for about a minute. Just be careful, it'll be hot. We're gonna add our vanilla extract, and we're gonna start mixing all of this together until all the chocolate chips are nice and melted. Don't worry though, if it doesn't get fully melted, you can put it back in the microwave for about 15 seconds. Just keep stirring until it gets nice and smooth or you get a nice thick consistency. Then you are ready to serve. You can serve it with all your favorite fruits and veggies and whole grain crackers, all of which are really good for your heart. Stay healthy, friends. See you next time. For the full recipe and more recipe ideas,
So how neat is that? I remember when I first saw the recipe, I thought, that's unique. I haven't tried broccoli with dark chocolate before, and I haven't tried sweet peppers with dark chocolate before. But then you start thinking about different flavors that go together really well. Chief among them, I always think of is peanut butter and chocolate. I mean, like, what an amazing combination, but like, whoever came up with that, that's a neat idea, right? Then I was thinking about like, what about mole? Mole has so many different flavors and it's amazing, right? So putting those ideas together, thinking outside of the box, adding your own special spark to it. Exactly, Miss Raquel. I love that. New combos to try, right? Having lots of fun. Why not? I remember during the time that everything was virtual, during COVID, like the first few months of COVID, we had offered cooking classes with kids online, and it was part of the Healthy Kids Project, and we'd meet a couple of times a week. And we made a salad. So we're like, we're going to, oh, of course, I'll be glad to put the code back up. Let me head on over here. We made a salad, and our goal was to incorporate something from every food group, right? So we had the protein, we had the fruits, we had the vegetable, we had the grains, and so we're like, okay, how do we put this together? What are things that we want to add? What are things that we maybe don't want to add? And then we had a recipe for a little dressing recipe that was made with honey and oil and vinegar and a little bit of water, and then just whatever spices they wanted, right? And we had a lot of fun with it. Didn't have to do it like that. It was just ideas, right? But one of the little girls, I remember very specifically, she said, well, I like blueberries with ranch. Is that okay? Sure, they're your blueberries, right? It's your salad. You can do with it what you want. So absolutely, the trying new flavor combinations for sure. Okay, so my friends, a few of you asked me to repost the link. I'll be glad to do that. I'm coming right up right here. And here we go. So you can just click on that link, or you can scan the QR code, whatever works out better for you, whatever you prefer. We've got one more video here, and then we're going to start wrapping it up. Okay, here we go. Cheesy broccoli mac.
hey friends, welcome to Healthy Kids. We're in that cool transition between fall and winter, which means I want something hearty and delicious. Cheesy broccoli mac. Let's get started. I've already got my butternut puree, yogurt, and milk heating up. We're gonna start adding our cheeses. Make sure that gets nice and cheesy. And then we can incorporate our pasta. Add your macaroni into it. And make sure everything gets nice and incorporated and cheesy. We're gonna add our broccoli. And make sure it gets all mixed together. And now we are ready for the oven. Make sure that you put this in an oven-safe dish, and we're gonna bake it at 400 degrees for about 20 minutes. Once you're done, it should look something like this. Now you're ready to take that to any family gathering. Stay healthy, friends. See you next time. For this recipe, visit klrn.org/healthykids.
So thank you, friends, for joining me for that. And I'll let you know, there's a couple of different ways to make this one. I really love all of these recipes, and I'm going to show you the PDFs are right below it. So every single one of these recipes is available in English and Spanish. And I'd like to call your attention to one part here. There's the ingredients, right? Everything's listed, the instructions, and check it out. Beside the instructions are recommendations for what the child can do independently and what the adult and child can do together, and then maybe what the adult needs to do on their own, right? So certain ones are going to have adult facing recipe cards. I think for cutting the watermelon, for example, that's something that the adult would work on, right? So really, really neat ideas here. This one in particular, the cheesy broccoli mac. How many of you have ever done the pan roasted vegetables? If you haven't had a chance to, we just started doing that. It's really easy and really yummy. You just get your fresh vegetables, clean them off, put a little bit of olive oil and maybe salt and pepper. Perfect. So y'all are familiar with this, right? This cuts down on prep time by quite a bit if you use the roasted vegetables. So like for us, we're a really small family. It's just my husband, my kiddo, and myself. So a lot of times if we buy something, it's like we got to figure out, okay, what's going to get frozen right away and what's going to get eaten right away and what's going to get cooked right away, right? So we have to figure out like how we're going to use this without it going bad. If that sounds like your family too, or you're just trying to look for different ways to use something, if you roast like a whole bunch of veggies at the same time, you can use them in different dishes. And this is one of those ones that if you roast the broccoli first, it's like extra tasty. You can also roast the butternut squash first. And so you have that like in chunks. That's a great alternative to if you want to change it up from having like potatoes or something, having roasted butternut squash is delicious. And that is something that makes it easier to blend because it's already soft. It's already been baked. So just an idea there. Friends, you all are awesome. I really, really appreciate your time. Thanks, Mr. Raquel. Thank you, friends. I'm going to go ahead and stop recording now. So we can call it a night. If you have any friends, thank you. Thank you, friends. Please do feel free to reach out. Let's see here.